to quality healthcare delivery has been the dream of every nation.
Though Ghana has made frantic efforts towards the achievement of the universal health coverage through the introduction of the community-based health planning and services strategy, over 60% of the population in Ghana are still rural, with poor roads, poor healthcare services, and inadequate skilled health personnel. The current population-to-doctor ratio of 10,032 is to 1 and population-to-nurse ratio of 1,240 is to 1 in 2011 is an indication that there are inadequate skilled personnel. This gap has been a major worrying trend. The introduction of Ghana's Community Health Workers Program, trained, equipped with smartphones, deployed and paid, was just one timely bold step towards strengthening our community-based health planning and services strategy towards universal health coverage. The initiative was jointly implemented across the 10 regions in Ghana by the Ministry of Health, Ghana Health Service, the Youth Employment Agency, Ministry of Employment and Labour Relations, and the 1 Million Community Health Workers Program of the Millennium Promise Alliance Ghana with other agencies. The Ghana Health Service and the Youth Employment Agency, together with World Vision and the 1 Million Community Health Workers Campaign of Millennium Promise, recruited, trained, equipped and deployed 20,000 community health workers and 1,000 e-health technical assistants nationwide. A demonstration site was established in 7 districts in Ashanti region. In Bosome-Frehon, one of the demonstration districts, the role of the community health workers was distinct.
The community health workers are indigenous people resident in our communities, the youth mainly, who have been recruited through community selection procedures and have been trained in basic community level health service delivery to be able to provide service to the doorsteps of the household members.
This is the most important thing I've ever seen. To not only just get community health workers, but to get the community health workers, volunteers, and train them. I'm also happy to also hear that they are going to be given Android phones to capture all the data.
The original motivation was to get people, especially the youth who have high school education, to be enrolled on the Chw program so that they are trained to be able to go and offer basic health services within the communities, especially the hard-to-reach area.
The story from 5 of the implementing regions in Ghana, Shanti, Northern, Upper East, Central and Greater Accra regions, says it all.
You can't imagine somebody who has given birth will be at the house and these people will go there for visitation, giving out medications.
Most at times you see them accompanying patients to the hospital.
It serves as a major bridge in bringing the community very close to understanding the workings of the health center.
The integration of the Chw into the health system is very good.
Of course, it's just about 2 years old. Going forward, we need to work out a system where all communities in Ghana will have the benefit of the services of the community health workers.
At full implementation, it is expected that there will be an average of 1 community health worker per 500 people, with variations between urban and rural areas. 30 more districts were added to the 7 demonstration districts in Ashanti region. Millennium Promise Alliance Ghana provided smartphones with a community-based tracking system to collect real-time data.
Ghana has pioneered for the whole world, and the lessons from Ghana have now been adopted by all of Africa because of how powerful and persuasive the results are. And that is the community-based delivery of health care, especially with the community health workers. Honestly, ladies and gentlemen, these are people saving millions of lives. Please give them a big hand.
Thank you.
We are, Jennifer, why don't you hand over one of the 6,000 phones on the way?
Community health officers were also trained and incentivized, and they also shared their views on the relevance of the community health workers to their work.
Well, with the community health workers, they are helping us a lot
to improve our coverage on antenatal, family planning, and child welfare clinic.
They help us in our day-to-day activities in the community, especially when we are going for home visits, conducting outreach, conducting debates, and school health services.
Anything that we are doing must be sustained. And once they live in the communities and the community members understand them better, if they are not there, there are a lot of cases that will be missing.
Their presence has helped to improve greatly TB detection and for management in the district.
The active involvement of the community members was not overlooked. Their active engagement in the selection of indigents who were trusted to be recruited, deployed and supervised to advance health care to the citizenry was such a great joy.
Community
for no a shot a woman do my imuno. And your man come a baba,
They've helped us in also explaining the CHIPS concept to the people.
We have so many self-medicated people. They form their own healing system. These choose people that educate them, that tell them they need to move away from the traditional way of healing to the hospital or the CHIPS facilities where they can get proper medication.
It was obvious that some of the trained nurses were willing to live and work in the remote areas of the country where their services are needed most.
Qualified or trained health workers do not want to go. They will be there once they are maximally trained to carry out these basic services. It will have an impact on service delivery and quality of care.
Several awards have been given out to motivate these frontline healthcare service providers. The awards include Best Community Health Worker, Rabi Abubakar, Asokore Mampo District; Best Community Health Officer, Susanna Ajoda, Bosome Freho District; Best Performance District, Amansia West District; Best Supervision District, Bosome Freho, and many more.
The Deputy Minister who is in charge of the training schools, Madam Tina Mensah, together with the health service, are coming to test that from now going, the consideration of the chiefs will not always based on the SS certificates. They will consider the work that
Saving lives and preventing various diseases, the community health workers highlighted their satisfaction on the job.
With the help of this program, the knowledge that I have acquired, I want to further my education, and at the end, I want to become a nurse.
My favorite part is you get to know much about the women, about babies.
But I think the e-health introduction has made this work so easier.
In fact, this work is so good. I have seen that it is very, very important to me.
This has helped these particular young people to be able to further their education based on the allowances that they take.
Monitoring has been strongly deployed to ensure accuracy in data and follow-ups.
The other addition is the vital event registration that the community health workers undertake, and this helps us to determine the population of the communities we work in, and once we have clearer information on the births and the death situation of these communities, we are better able to tailor health services to meet the needs of these communities.
One can say that Ghana is really on course of our universal health coverage efforts.
Sometimes we cannot even do without them, because when they are not there, sometimes the CHIPS zone will have to be closed.
With funding support from JSK, Jenny Gross, British Telecom, and Jacqueline Kobeli.
We are able to leverage on the information, education, communication materials, that's the IENC materials, to provide decision support for these community health workers as they go to the household, so that they engage the people through these audiovisual materials and get them excited so that they change their lifestyles.
Several deaths have been prevented by the Youth Employment Agency Ghana Health Service Joint Intervention. It's your turn to do even more.